Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, some of the highlights. Today, 13 lawmakers test positive to the coronavirus in Edmo State. Cross River dismisses stories suggesting that a lawmaker in the state has died of COVID-19 and says the state is free of coronavirus. A new infection spike across several U.S. states as country reopens. Following the global rise of COVID-19 cases in the last 24 hours, Nigeria recorded 675 new cases and 7 deaths. A total of 7,109 COVID-19 patients have recovered from the disease and discharged in Nigeria out of the total of 20,919 confirmed cases. While the NCDC also puts a death toll at 525, it has conducted 15,760 samples across the country as it continues to expand its testing capacities. Now, of the latest 675 infections, Lagos has 288 cases of that number. Oyo 76, Rivers 56, Delta State 31, Ebonyi 30, Gombe 28, Ondo, Kaduna and Kwara 20 each, Ogun 17, the FCT 16, Edo 13, Abia 10, Nasarawa and Imo 9 each, Borno, Bayelsa and Katsina have 8 each, 3 each in Sokoto and Bauchi, and 2 in Plateau State. Looking at a breakdown region, Lagos State in the southwest remains the epicenter of the pandemic in the country. It has 8,864 cases. The FCT is next and top in the north central with 1,583 cases. Kano tops in the northwest with 1,190 cases. Rivers in the south-south with 930 cases, and we have Borno in the northeast with 476. Ebonyi topping the southeast states with 264 cases. 13 lawmakers in Edmo State have tested positive to COVID-19. Our correspondent, Edmo State reports that the lawmakers' samples were taken after one of the lawmakers a week ago tested positive for COVID-19. According to the Edmo State COVID-19 task force, the lawmakers and their families have gone into self-isolation.
It could be recalled that after the State House of Assembly was shut down following the case of a lawmaker who tested positive to the coronavirus disease. The samples of other lawmakers and their aides were taken, and the result is out. According to reports, 13 more lawmakers have tested positive to the coronavirus, and they've gone into self-isolation. We went round Owerri, the Imo State capital, to get the mood of the people on this new development.
Whatever safeguards we have taken have failed to have affected the lawmakers. Then since they are affected, you know how dangerous it is to the common man.
This COVID-19 is coming from up down. So if they test COVID, positive to COVID-19, it can't come to anybody as a surprise, judging by their position and the caliber of people that they meet on a daily basis.
People are still arguing whether the thing is still existing or not. But to me, with what is happening, the thing is real. To my own assessment and what is happening all over the world and other countries. The advice I have is that let the government continue trying to find a solution to it.
According to the NCDC, with a total of 243 confirmed cases of the coronavirus disease, Imo State is coming behind Ebonyi State as the second highest number of COVID-19 cases in the southeast. The state government is still appealing to indigents to continue to comply with the precautionary measures put in place by the government to contain the spread of the virus. From Owerri, the Imo State capital, Edmo State for COVID-19 update.
The Cross River State government has debunked rumours surrounding the death of Honourable Godwin Akwaji, a member of the Cross River State House of Assembly representing Obudu State constituency, who died last weekend, which was to be COVID-19 related. While speaking at the state's Ministry of Health in Calabar, the Cross River State capital, the Commissioner for Health, who doubles as the Cross River State COVID-19 Task Force Chairman, explained that the Honourable member was not COVID-19 positive as suspected following tests conducted. Dr. Betta Edu frowned at those peddling fake rumours on COVID-19 status of the state, with a call on them to desist.
There's the rumor making the rounds. In fact, someone called and threatened that if they're not given monies, they're going to bring up a new rumor. It's becoming a business stuff. They're going to bring up a new rumor. They say there is, we have 2 commissioners in isolation, 2 chairmen in isolation, all sort of things terrible. We also had last weekend where we lost one of our House of Assembly members. And of course, we condole with the family. However, that death was not as a result of COVID-19. It's just funny and terrible that persons have so desperately wished or projected that we must have a COVID-19 case. But my speech to them is to apply caution and be patient. We also had last weekend where we lost one of our House of Assembly members. And of course, we condole with the family. However, that death was not as a result of COVID-19. I want to say this. It is not medically correct to stand here and state the illness of anyone without due permission from the family or the next of kin. I'm sorry, in as much as I would like to tell the world what our dear legislator probably went through, I do not have such medical rights, and they could cost me my certificate.
Over in Abia State, the Executive Council has applauded the Governor, Kezie Ikpeazu, and the members of the State Interministerial Committee on COVID-19 over the successful launch of the state-owned testing centre at Abia State Specialist Hospital and Diagnostic Centre, Amachara. The Abia State government says it is increasing its testing capacity in hopes that another testing centre will be opened, this time in Aba, and they're looking at next week. The ESCO members also advocate for strict adherence to the COVID-19 protocols, wishing those at the COVID-19 infection management centres in the state speedy recovery. Staying in the southeast, in Enugu State, 49 health workers are set to be among the 144 persons with confirmed COVID-19 cases in the state. 110 of those cases are active, 29 discharged, and 5 deaths have since been recorded. The government says the health workers have continued to do their best in the prevailing circumstances to deliver on their mandates. According to the Commissioner for Health in the state, is calling on residents not to suffer in silence, as this is not a time to avoid visits to hospitals when medical attention is needed. He also restated the state government's resolve to continuing to identify cases by testing, contact tracing, as well as decontaminating homes, workplaces, hospitals where identified cases and their contacts have been. Now, Dr. Kelly Wacha is a pharmacist, and he joins us from our Abuja studio. We'd like to thank you for joining us on the program.
Yeah, thank you, Millicent, for having me on this program.
Great. Let's start with talking about the African fight. African countries' latest news was that they're pooling together resources to set up a sort of one-stop shop to give the continent a better chance. COVID-19 test kits, protective equipment, and any vaccines that may emerge. First, is this an initiative that you think can reduce the spread of COVID-19? And second, will it foster solidarity in the fight?
Yeah, it is true that some African countries have come together to champion this COVID-19 cause. It will prove very effective if managed properly. But there are some challenges. The cultural differences that operate amongst these countries might pose serious challenge to discuss. Again, the issue of distribution of some of these protective equipments, assuming they come up being manufactured or produced in a particular place, will be a real problem. So I would like to advise that each country go on their own to handle this challenge. But if there is need to seek for some collaboration, yeah, there's nothing wrong in doing that.
So some have said that Nigeria's fight is similar to that of other countries, and that the journey ahead is really what a lot of people fear, seeing what countries like Brazil are going through and even the United States. So the question is, do you think Africa will be able to control the virus with fears of a possible second wave in other continents?
Seriously, with the way things go in Africa, I have my doubts if we'll be able to manage an upsurge in this challenge. Developed world like the US, developing world like Brazil are having challenges in the upsurge. You can imagine what could happen in Africa that I would describe as not even a third world. We have dropped from third world to if there's something like fourth or fifth world. So the problem is, how are we going to cope? It gives me real concern regarding this second upsurge. And that possibly brings me to the issue of our people not internalizing the fact that COVID-19 is a reality. Because the way we are going about this in this country, particularly on the part of the ignorant members of the populace, in fact, we have to be pretty watchful, because if it implodes the way everybody is preaching or contemplating, definitely we may have a problem really having to manage this if it gets to that level. So but my prayer is that we don't get to this level at all. If you do get, like I did say earlier on, oh my God, only God will be, in fact, we all retire to the churches and the mosques, which we are not even going to now, to be praying for, for any
Dr. Wacha,
measures. But it's a big problem for us anyway.
If I may, looking at the stigma, perhaps disclosure issues, do you think that that is still a major concern for us? Are we not doing enough with sensitization? Are people not aware of the virus and the dangers?
Yeah, the issue of sensitization has been on. There's been a lot of ICE materials that's published here and there in the social media, in the print media, that's on televisions. But that is on that part. Messages are passed. But the people for which these messages are meant, how are they seeing the messages? Are they actually taking in these messages? Do they really believe that this is happening? Now, this is actually a problem. Now, another problem, like you did say, has to do with the concept of stigmatization. I do not see why people should stigmatize clients the way we say it in pharmacy, who have COVID after they must have been treated. This is a case. Last night I got a call from Lagos about somebody who had who's suspected to have this, based on the kind of counseling he wanted me to give. So I could see from the call that it had nothing other than he wouldn't want to be stigmatized against. But of course, professionally, I have to go by the confidentiality clause that not just we, the pharmacists, are sworn to. But I counseled him the much I could and told him what and what he needs to do. So stigmatization is a big problem. Until we get out of this, it might be an issue. Now, getting out of this, how do we handle it? We need to look at the healthcare facilities and the healthcare professionals that have the greatest access to these patients. And who are these? No other persons than the pharmacist. The pharmacist and the pharmacy are the first point of calls for anybody that is sick.
We wish we had more time, but we'd like to thank you.
I want to appeal to government.
Dr. Kelly. We'd like to thank you so much, Dr. Kelly Wacha, a pharmacist. Thank you for your thoughts on this very important issue. Hopefully you'll join us again. All the best. A 100-bed space treatment center has been commissioned in Taraba State, and according to the state government, this is coming due to support from some financial institutions. The Deputy Governor of the state, Mr. Haruna Maru, says there are plans to effectively manage COVID-19 cases and establish more centers across the state.
This center is further consolidation of the effort of the government to contain the outbreak of the coronavirus pandemic. Since the first index case was reported on the 27th of April 2020 in Taraba State, government has not relented in its responsibility of taking practical and proactive measures to stop further spread of the highly infectious disease. This administration has also tried to maintain a high level of preparedness for management of case. Medical consumables, including procurement of 4 ventilators for the specialist hospital Jalingo, for protection and case management have been procured, and health staff have also been trained. So much still requires to be done, and this is amid dwindling resources available to the state. Government is still planning to provide more treatment isolation facilities in other locations of the state and provide more protective equipment for health workers and drugs and equipment needed to manage cases.
Let's get more from a public health physician, Dr. Bekia Yusuf, who joins us here in Lagos. Welcome to the program.
Thank you. Glad for being here.
All right. I would like to start off with what Dr. Kelly Wacha, the pharmacist, was saying about there seems to be a lot of stigma. And the NCDC recently said that there appears to be, decades of mistrust in terms of some of the things they identified as the challenges in their campaign of COVID-19. Why do you think this is still happening with all that's going with, the number of people that have died as well?
Well, as we can see, the COVID-19 pandemic is not just, for Nigerians alone. We have over 200 countries who are facing the same issues, and we are fighting the same cause. Now, the stigmatization has been a problem, and that's the more reason why we have people not coming out to actually speak up on this infection. Over the years, because of the profound form of stigma, it's difficult for one to come out and disclose that, look, I had this infection and I'm fine and it's real. So given the differences between stigma and letting people believe what is happening, it's making it difficult for this containment to happen.
Do you think the government is at a crossroad between stopping a public health emergency and the economic impact of it?
Well, presently, obviously, they are in the crossroads, and you cannot leave one for the other. It's an issue that has to be, tackled simultaneously. the public health pandemic we are having is going to definitely affect the economic well-being of the country. So, but notwithstanding, we have to, kind of put a form of a balance between both and see, and understand that the people are quite important. And if we have healthy work first, human first, we're going to have a very good economy. So that's something we have to put behind our minds.
I want to quickly get your thoughts on the asymptomatic transmission. The Minister of Health has said 80% are as a result of asymptomatic patients. And then we also have the World Health Organization saying that it's not clear yet as to that number and the transmission of COVID-19.
Like we've always been saying that this coronavirus issue, it's an ongoing problem that we are all learning by the day. And as the day goes by, we can tend to understand the virulence of this disease. Now, concerning the asymptomatic transmission, the World Health Organization actually said something about it not being a major means of transmission. However, there's been some form of transmission, no matter how small. The percentage is quite small to those who transmit symptomatically. So that's why we are having community transmission in the first place. Most people go around being asymptomatic. We need to remember that we had some days of what we call the incubation period. And when we're talking about an incubation period, that time is the time between the transmission, the infection, and the display of symptoms. So within that period, one is asymptomatic. So there's every tendency that one can actually transmit. That's why we keep on advocating that if you have any reason to step out of your house for whatsoever reasons, it's best you keep to the safety measures because you don't know who's carrying the virus.
All right. Well, nice to thank you, Dr. Bekia Yusufu, public health physician. Thank you for joining us.
Thank you for having me.
Florida has surpassed 100,000 coronavirus cases with 2,929 new infections, raising the state's total to over 100,000. Many other states fear a second wave in the country, with the Texan government reconsidering a new lockdown. Globally, there are now over 9.1 million cases, 4.35 million people have recovered, and the death toll from the virus stands at more than 472,000.
A lockdown is being reimposed in the German region of Gütersloh after a coronavirus outbreak linked to a meatpacking plant. Social distancing measures will return to the level of March. People in the district can only meet people outside who belong to their own household. Indoor group activities will be banned. Concerts, cinemas, museums, galleries will be closed. Sport in closed rooms will be banned. Gyms, swimming pools, and saunas will be closed. Picnics and barbecue will be banned. Bars and cafes will be closed. Restaurants can only serve meals to go. As the number of people to die in connection with COVID-19 in the U.S. passes 120,000, the state of Florida alone has now reported more than 100,000 confirmed infections. Nearly 3,000 new cases were diagnosed, according to local health officials. Newborn triplets in Mexico have tested positive for coronavirus in an unprecedented case, according to local health authorities. Medical experts are investigating whether the disease could have been passed on through the mother's placenta during pregnancy. Two of the babies, one boy and one girl, are in stable condition in a hospital in San Luis Potosi State. A supercomputer in Japan is being deployed in the fight against coronavirus pandemic. The large machine, named Fugaku, is being used to simulate how droplets will spread in office spaces with partitions installed or in packed trains with the windows open.
According to the NCDC, a sudden loss of taste and smell with fever, headache, or runny nose may be COVID-19. Please do not ignore the symptoms. Call your state hotline immediately to arrange for a test. You can visit their website. It has regular updates on the COVID-19 regulations and the guidelines. From the World Health Organization, you find the coronavirus disease situation dashboard with the latest global numbers by country of COVID-19 cases on a daily basis. The website has rolling updates. You can take a closer look at some of the numbers in real time. Our website, channelstv.com, has the latest news. All you need to do is log on and access news in health, politics, from Africa and around the world. That's our COVID-19 update. Thank you for watching. I'm Millicent Walker. Stay safe.